After 8 months, 7.4 million cases and more than 200,000 deaths, with the nation in turmoil and the economy in tatters, it's finally happened. Donald Trump's taking COVID seriously.
It's been a very interesting journey. I learned a lot about COVID.
And all he had to do was catch it.
I learned it by really going to school. This is the real school. This isn't the let's read the book school. And I get it, and I understand it, and it's a very interesting thing, and I'm going to be letting you know about it.
But first, the president did a quick lap of Walter Reed National Medical Centre, delighting his supporters.
Going home tomorrow, hopefully! I will die for that man, happily!
And endangering his security detail, who might actually die for that man. One Walter Reed physician blasting the astounding irresponsibility of putting Secret Service personnel in the hermetically sealed presidential SUV, all for political theatre. Back at the White House, the confusion and suspicion grew.
I understand why the American people might be concerned that they feel like they're not getting honest information from this White House.
Just candidly, we've provided 3 letter updates from Dr. Connolly. He's given 2 on-camera briefings.
Yesterday, you told us that the president was in great shape.
White House Chief of Staff Mark Meadows told reporters that the president's vitals were very concerning.
Whose statements about the president's health should be believed?
I think his statement was misconstrued.
But here's what we do know. Trump has received supplemental oxygen twice, as well as dexamethasone, a steroid usually reserved for critical patients, remdesivir, an experimental antiviral drug, and Regeneron, an even more experimental antibody treatment. Taken together, it's a hell of a cocktail, either a major overreaction or a cause for major alarm. So while his treatment team's staying positive,
our hope is that we can plan for a discharge as early as tomorrow.
Just how serious could the presidential prognosis be?
Well, Professor Sharon Lewin from the Doherty Institute knows the virus inside and out, and she joins us now. Sharon, what does this combination of drugs tell us about Trump's condition?
Well, Trump's received 3 drugs. 2 of those we use commonly. That's remdesivir, an antiviral drug, and dexamethasone, a steroid. And they're usually used in people with moderately severe disease, meaning that they require oxygen in addition to help them breathe. He also received an experimental agent, which was an antibody infusion, which is not part of our routine care. Altogether, that tells us he's sick from COVID and has moderately severe disease.
Not more than moderately severe, or are you just saying at least moderately severe?
Just to go back a bit, what do we mean by severity? Because I don't think many people would understand that. COVID causes a range of illness. First of all, people can be completely asymptomatic, no symptoms at all. They can have mild symptoms, a cough, a fever, a runny nose, or they need admission to hospital. When they're admitted to hospital, they could require oxygen, and that's usually determined by measuring the amount of oxygen in their blood, and if it's less than a certain level, they're given extra oxygen. And then you can be given even more oxygen, something called high flow oxygen, or eventually if you get too unwell, you get placed on a ventilator. So he's nowhere near that from what I can tell, and we've seen him giving a speech, we've seen him in the car, that's another story, but we do know he's needed oxygen. So I'd say, moderately severe in the language that we use for COVID.
Would it be a risk to give him all of these kinds of treatments if his condition's actually mild?
It would actually. We know, especially with steroids, the dexamethasone, they have a benefit in reducing mortality in people that are on oxygen or being ventilated, and they have very minimal or no effect with people that are not on oxygen. And all treatments have adverse events, and especially steroids are associated with quite a long list of adverse events. So you definitely don't want to be giving steroids if you don't need it. With remdesivir, the antiviral drug, that's a little less clear. It looks like remdesivir, the antiviral drug, works better in people with milder disease. So remdesivir actually didn't have a mortality benefit. It just reduced the time to recovery from 15 days to 11 days in people that were on oxygen but not ventilated.
Sharon, we saw Donald Trump release that video before he went on his little parade. Judging by the video, he looked fine, he sounded fine. What can we take from that?
I'm not sure we can deduce much. Actually, people can often, especially it's been described with COVID, that you can underestimate the oxygen in your lungs, meaning that you feel quite good, don't feel breathless, and then you have the oxygen checked and it's quite low.
Professor, given we're doing a long-distance diagnosis here, Donald Trump's obviously in the middle of an election campaign. If he's in the condition that you've just described, how quickly could he reasonably get back to work?
You know, I'm not sure. Most people feel pretty crappy after they've had COVID, been in hospital, been on steroids, been on antivirals. It's unusual that you just bounce straight back into normal work. And in fact, you know, there's a significant number of people, up to about 15 to 20% of people who have quite prolonged symptoms after COVID. I'd be pretty surprised that he could get back to work. But, you know, Donald Trump's full of surprises.
How much is his age a factor?
Well, his age is definitely not a good thing for COVID. We know that if you're over 70, your risk of death is substantially increased, estimated at about 10%, may even be higher. He's also a little bit overweight. That's not so good. And he's male. And those are three things that are not in your favour on doing well post-COVID. However, the reports we're hearing now is he's received his treatment. They're saying he might even be discharged. Maybe he's improving.
Sharon, can we talk about the driver for a second, who's certainly taken one for the team here? I mean, I'd hate to think that he didn't have a choice in the matter, but I mean, he was so close to Trump. What are the chances that he now has it?
Well, you know, that was an extraordinary thing to do. So we would normally isolate people who are infected with COVID-19 and minimise any interaction. If people are in close contact and they're at risk of being infected, then contacts need to be in quarantine for 14 days. I'd imagine that the driver would need to be in quarantine after that exposure.
Sharon, we appreciate your thoughts tonight. Thanks so much for your time.
All right, thanks very much.